It is Suicide Prevention Month, and this is a great opportunity to revisit some of the questions that a lot of people don't have a person whom they can ask directly about how to help themselves or someone they love who may be at risk for attempting or committing suicide. Hello, and welcome to the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe to my channel if you want to continue to learn from me. And also, please reach out and send me an email at askdrglasner@gmail.com if you have a question that comes up from one of the topics in my podcast, or if you have a guest or a topic you'd like to suggest. I would love to hear from you as we continue to build our community. First, I'm going to talk a bit about who is at risk for suicide. Second, I want to talk a little bit about the warning signs that you should look out for if you're concerned about someone. And third, I want to talk a little bit about what you can do. So let's just talk first about the risk of suicide. We know that in 2020, suicide was the 9th leading cause of death for people who are aged 10 to 64, and the 2nd leading cause of death for those between the ages of 10 and 14 and 25 to 34. So we know that suicidal behaviors were really accelerated during the COVID-19 pandemic when people were super isolated. There was a big increase in mental health issues, addiction, substance use among people who either had a pre-existing substance use disorder or had developed some new and unhealthy behaviors around substance use in attempts to cope with the loneliness and isolation and all the stress around illness and infection and all that brought with it. We know that suicide normally doesn't have a single cause, but up to 90% of people who completed suicide met the criteria for a psychiatric disorder. And that's mostly mood disorders, substance use disorders, or personality disorders. About 1/2 to 2/3 of all suicides are conducted by people who suffer from mood disorders. And the risk with bipolar disorder is especially high. It is the highest suicide risk of all the mood disorders. And the longer you go without treatment, the higher the risk of suicide. So we also know that suicidal behavior is very problematic for people with what we call co-occurring disorders, or two psychological disorders that are occurring together. It could be two or more. And so that typically includes both a mental health issue and a substance use issue. And intuitively, you can see why that would become what we call disinhibited or a little bit more impulsive and do things they wouldn't ordinarily when they're under the influence of alcohol or other substances. And that includes self-harm behaviors. So we know that alcohol use is associated with 94% increase in the risk of death by suicide, according to studies. And then studies show that cannabis use carries a risk of death that is nearly 10 times greater for those who have an addiction to cannabis relative to those in the general population. And that risk is most pronounced in people between the ages of 25 and 44. If you're somebody with a mental health disorder, or your loved one is someone with a mental health issue like depression or anxiety or a personality disorder such as borderline personality, and then layered on top of that, they also have a problem related to substance use, they are at higher risk of suicidal behaviors and completion of suicide, and really should have both of the conditions that they are struggling with addressed simultaneously, if possible, in order to improve the likelihood of a good outcome from treatment. So now let's talk a little bit about the warning signs. What are the signs that you should be concerned about somebody having suicidal thoughts or potentially suicidal behaviors? So it has to do with what they're talking about, how they're feeling, and ways that they're changing their behavior. So if they're talking about wanting to die, if they're talking about feeling a very intense sense of guilt or shame, feeling like they're a burden to others, those are indicators of risk or warning signs. If they're expressing that they're feeling empty or hopeless or trapped or feeling as though they don't have a reason to live, if they're extremely sad or more anxious than is typical for them, agitated or even full of rage, if they're experiencing what they describe as unbearable physical or emotional pain, those are all important warning signs to pay attention to. And then if they're showing changes in behavior, that's the other thing to look out for. So if they're making a plan or researching ways to die, if they are withdrawing from friends, giving things away, seemingly saying goodbye, or making a will, if they're taking dangerous risks, such as driving extremely fast, showing extreme mood swings, eating or sleeping more or less, using drugs or alcohol more often. I know that a lot of these things may be difficult to link to suicidal thoughts or behaviors when someone's not directly expressing them, but just think about these types of behaviors in combination with the feelings of the things that they're talking about. And also know that if your gut is telling you to be concerned, don't wait for more symptoms or problems to unfold. Do something about it. First of all, if you notice these warning signs, you want to get professional help as soon as possible, particularly if the behavior is new or if it's increased recently. If the person has a therapist, a psychiatrist, or even a general care physician or a GP in their life, I would reach out to that person or help them to reach out to that person. In the more immediate, you could help them call a crisis line. There are free resources for everyone. 988 is a great one. You can call or text 988, and that will give you access to a very caring and well-trained individual who can help talk you through 24/7 a crisis or feelings of wanting to die, helping be there, support you, and or direct you to other resources that you might need. Intensive or a different form of assistance is needed. They can help make that determination and get you or your loved one to the right place. In general, one of the things to keep in mind is that suicide is something that is really scary to talk about. People don't like to talk about it with a loved one when they don't feel like they're necessarily qualified as a mental health professional to do whatever needs to be done. And I think that is one of our shortfalls as a society, is that we're so uncomfortable talking about this that people who are at risk end up feeling like they are not being taken seriously or nobody is listening to them. And that can be very risky. So there have been studies of people who've survived suicide, and a couple of things that you should know. One is that if a person who is feeling suicidal can be prevented from being impulsive and acting immediately, they later feel grateful to be alive. This tends to be fairly fleeting. People have studied those who've survived suicide and found that 70% of them thought about it for less than an hour. 24% said that the idea occurred to them less than 5 minutes before they did it. So the people who study it, research it, really plan it out are in the minority. That's about 13%. But the people who make attempts by and large and survive them by and large are not thinking about it for very long. So in that short window of time, if there was someone there who could have talked to them, been supportive of them, listened to them, directed them to some resources and gotten them some mental health assistance, that would have been very helpful. And if you feel underqualified for this, there is something called mental health first aid. And it is a training program that's open to anyone for how you talk to people with mental health concerns in a way that is helpful. We also know from research studies that asking survivors what could have helped them prevent their attempts, one of the number one things that emerges from these studies is that people felt that their suicidal thoughts were not taken seriously enough. So the real critical needs that have been identified in these studies are the importance of restricting access to means of attempting suicide. So if you are close to somebody who's having these types of thoughts, anything you can do to restrict their access to weapons they can use or pills they could overdose on. Maybe they need someone to manage their medication and dispense it to them for a period of time while they're going through something. Giving greater consideration to actions they might be taking in preparation for suicide, and just really fostering open dialogues about suicide. As weird as that sounds and as difficult as that sounds, what people thought in these research studies when they were asked would have helped them would have been really a more direct approach where people would directly ask them about their suicidal thoughts, questioning their state of mind, acknowledging their distress and despair, really providing a safe space for them to have discussions about their feelings and thoughts related to their desire to die. Those things all would have been helpful. And I think one of the things that people often fear, especially when it comes to younger people, is that they're going to plant the seed and the idea of suicide in somebody's head if they start talking about it. There have been studies on that as well, and that has not borne out to be true, that talking about suicide has not been shown to increase the risk of suicide for people who are already at risk. It actually reduces the risk of them acting on some of those thoughts because it gives them a place to air some of those feelings and feel heard and understood. And that in and of itself can help them restore their stability and their mental health in such a way that it can actually help them resolve some of those thoughts and those urges. Many of the participants in research studies on suicide survivorship reported that the consequences of their death for their family, especially nephews and nieces, really acted as a protective factor for them, protecting them from making an attempt. They also reported they had thoughts about not being able to see their nieces and nephews growing up or their loved ones growing up, the difficulty for the bereaved to explain the reason for their death, and the feeling of not having shown up as a role model for those people in their life. And the presence and need to care for a pet also was a protective factor against making a suicide attempt. So the capacity to have open conversations about a person's struggle with these types of thoughts can really be helpful to them, to help them process it, to think about the potential impact if they weren't around. It's a difficult thing to talk about. And again, you don't want to go too far outside of your league if you're not a mental health professional, but giving the person a sort of safe space to air some of the thoughts and feelings that are concerning to them, and then gently guiding them to a mental health professional who can have a more in-depth discussion, it could be really helpful. Let me just summarize some of the steps you can take if you love someone who you're worried about. And this is not to replace professional help from a licensed clinician, psychologist, psychiatrist, physician. This is meant to equip you with a framework for being helpful as a bridge to getting that person that professional help that they need. So the first is to ask them if they're thinking about suicide. As weird as that may feel, studies show that asking does not increase suicidal behaviors or thoughts, and it helps build the rapport and trust that will enable that person to feel understood, heard, and maybe more open to getting help. Second, just be there. You don't have to respond to anything that they're saying with sage advice. It's more about being there and listening in a non-judgmental way. And studies show that acknowledging and talking about suicide can help reduce suicidal thoughts. The third is to help keep them safe to the extent that you're able to. So ask them if they have a plan and restrict access to means to the extent that you're able to do that. And you probably want to do this with the help and support of a mental health professional for yourself if this is something that you're doing for your family member, just because this can feel like a very heavy weight and can feel very scary. Help them connect with resources. So I keep bringing up this topic, but you don't really want to take this on your own on behalf of your loved one without professional help. If they don't have a professional in their life or immediately available, lean on resources like the 988 hotline and other resources in the links that I will put in the description of this episode. And then finally, following up. So it's just staying in touch with someone after they've been through a crisis, letting them know, hey, I'm thinking about you. How are you feeling? Is everything okay? Is there anything I can do for you? Studies show that supportive, ongoing contact can be a very important practice in preventing suicide. And then finally, just thinking about some of the protective factors for suicide. Good social support is a protective factor. So just being there for somebody, to listen to them, to support them, to guide them to support resources that are professional in nature, helping them find a therapist, somebody who can support them, that is also going to reduce the risk of self-harm. Family cohesion and involvement, especially for young people, is a buffer that protects against suicide. Involvement in school activities for young people also is really good for mental health. Helping people to learn problem-solving skills and the ability to consider different options of ways to solve problems. So we know that one of the things that increases the risk of suicide is acutely stressful situations happening in life. So if you already have vulnerability based on your mental health or substance use, and then something happens, like you lose someone, or you go through a relationship transition, a divorce, lose a job, all kinds of life stressors can make somebody at greater risk for these types of thoughts and behaviors. So to the extent that they have really solid problem-solving skills and the ability to respond in a resilient way to problems that arise, that will really help equip people in life to kind of deal with the types of hurdles that could rattle them if they aren't really feeling strong in their ability to navigate life's problems. And those are skills that you can learn in therapy. If they don't come naturally to you, that's okay. Having a lot of reasons to live. So generally, having sort of a list of things that you have to live for, things that you have to be hopeful about, times in your life that have been great, and connecting to those times with a desire to recreate some of that happiness. Those can all be protective factors. Cultural and religious beliefs that provide meaning and discourage suicide. So I hope that you learned some valuable tools from this discussion. And remember, you're not on your own. You are not alone with this, whether it's you having these types of thoughts or somebody you love or care about. There are a lot of resources that help people who are struggling with these types of thoughts, as they have become increasingly prevalent in our society, especially post-COVID-19. And with Suicide Prevention Month here, this is really a time to reflect and think about what we can do to keep one another safe. So thank you for tuning in, and I look forward to seeing you next time.